179 new locally transmitted cases confirmed today. 130 are linked to the Jurong Fishery Port Cluster, which now has 451 cases. 8 of today's cases belong to the KTV cluster, and that's grown to 215. 2 imported cases were also reported today, with both developing the illness during SHN or isolation. Further updates will be shared later tonight. Infectious diseases specialist Dr. Leong Ho Nam from the Rofi Clinic is here with me now. Welcome back to the show, Doc. So as we enter a 4-week period of tighter restrictions tomorrow, what are the markers to look out for before we can emerge from phase 2 heightened alert? Is it to bring down local cases to single digits?
You see, if we actually identify individuals that already have been known and they've been quarantined, that's fine. Actually, the numbers to me are not important. What I really want to see are the number of unlinked cases. Unlinked cases that comes down then tells us that we are actually catching all the anticipated cases. Now we still have about 30 unlinked cases, and that's quite worrying because you wouldn't have quarantined them, and in turn each of them can transmit to another 2 or 3. So potentially from this 30 you can have already another 60 to 90 cases. So I am still worried.
Another worrying point, Doc, is that, the number of seniors who remain unvaccinated. Among today's local cases, MOH reported that 4 are seniors above 70 years old who are unvaccinated and at risk of serious illness. Singapore's reopening plans largely hinges on getting our seniors vaccinated. Health Minister Ong Ye Kung saying yesterday around 200,000 seniors 60 years old and above are still unvaccinated. Have a listen.
But there remains over 100,000 unvaccinated seniors over 70 years old. And if you add those that's above 60 years old, that's another 100,000 or so. There's altogether 200,000 above 60 years old. And they have a high likelihood of falling critically ill once infected. Almost every one of them, if infected, will end up in hospital because they are high risk. And 10 to 15% of them, based on our experience, will end up in ICU. So imagine 200,000 people. If we have widespread infection, just 10% of them, let's say 10% of them get infected, that's 20,000. All 20,000 will be in hospital. Amongst them, 10 to 15%, that's 2 to 3,000, will end up in ICU. It's huge, huge number.
Well, Dr. Leong, back to you. Convincing reluctant seniors to get their COVID-19 jabs is a long-standing issue, a long-standing problem. What isn't getting through to this group, and what do you have to say to them?
Ollie, thank you very much for this pertinent question. It really tells me that the big story is really concerned about the elderly, and my story to them is this: you need to get yourself vaccinated. The data is very, very clear. If you've been vaccinated, hardly anyone needs oxygen. In fact, it becomes a common cold. What if COVID-19 becomes a common cold? Life goes on as normal without any mask at all. Now, I have Dr. Carol Tan, who has been knocking on the doors of various groups and trying to find out why these elderly are not vaccinated. The answer is because they were told they are not suitable because of an allergy. Well, that's completely wrong. That was in the past. In the past, we were worried that the allergy may be triggered and in turn cause more problems. The message out there is, even if you have an allergy, you can go for vaccination. Even if you have a stroke, a heart attack, any past medical illnesses, practically every condition, you can get yourself vaccinated. In fact, when you get yourself vaccinated, if you're an elderly, you would protect yourself from falling badly ill, and in turn, you would actually save time for your family and your family members, because they wouldn't have to go into the shelter, into the hospital, and look after you. Now, I'm going to give a challenge out here to all the TVS, the Big Story fans here. You enjoy the stories, and you are getting updated every day. But the trouble is, many of the elderly are not getting the story. I would like you to hear this story, hear the need to vaccinate the elderly, and go forth and share this message. Go out there and tell, you need vaccinated. You need to be vaccinated to actually protect yourself and in turn protect the nation. Now, Mr. Ong Ye Kung actually gave a figure of 200,000. That sounds very scary. But if we actually aim for 75% of the population that's vaccinated, 25% will still fall sick, which is 1 million people. That's huge. Can you imagine? Total tally 1 million people. So you as an individual, if you have been vaccinated, I now ask you to become an advocate for the vaccine. Go out there, find an elderly and say, Uncle, Auntie, let me take you to the vaccination center. I've done it. You're going to find, and I'm going to get you vaccinated, and I'll take you home thereafter. Find that elderly, save that life, be that lifesaver. Launch TBS into the big story with a big vaccination drive.
Well, let's look to something else, Doc. The task force said we've hit the 50% vaccination target, and hopefully we're still on track to get 2/3 of our population vaccinated by National Day. Only then can we consider transitioning to a new normal. What sort of case numbers are you projecting in this eventuality?
Actually, I'm not too optimistic. At 50% cases, I'm still rather disappointed because you have only about 67 to 88% protection after you have 2 doses. And I know the ministry has talked about 75%. Well, I'm still not happy with it because Dr. Leong Hunam's figures here is actually 90%. I want a good 90% of the people vaccinated, and truly then we can actually keep the numbers down. What will be the new normal? I think we will want to talk about everyone still has to wear the mask on because even if I've been vaccinated, I may still spread on to other people. Number 2, we want to avoid crowds because cases will still pop up and we don't want to overwhelm the hospitals immediately. And I'm going to take a cue from from UK. UK had Freedom Day, but the virus also had their freedom moments because we see the number of cases going up immensely. Cases will continue to occur in Singapore, and with a target of about 75%, like I said, at least another 1 million people will get infected in Singapore. Big numbers, which means we have to slow it down, just like what Mr. Ong Ye Kang has said. If you're vaccinated, well, expect a simple common cold. You take the teeth out of the bite of the virus, you won't die, you're going to be just great. In fact, but if you are not vaccinated, I will be worried. There's an 8 to 10% chance you'll be hospitalized. There's a risk of about up to 1% risk of dying. And then effectively, the Ministry of Health feels that mRNA vaccines are the only effective vaccines. So going forwards, I'm still quite bleak about the future. But if we get the numbers up to 80 to 90% vaccination, the sunny Singapore can come back again.